So we're going to go ahead and check and see if Thomas is back in, and we won't be able to see him necessarily right away, but we'll ask him if he is on the line, perhaps sharing a telephone with someone else now. If he could raise his hand using the raise your hand function in the chat bar. But we'll give him a minute to kind of pop back up if he's in.
Yeah.
But what we're going to do while we're waiting to see if we can bring him on the line is to talk to another one of our great colleagues here in OASH, and that's Sonsiere Cobb-Souza. And she is the director of the Division of Program Operations for the Office of Minority Health at the U.S. Department of Health and Human Services, HHS. And there, she busy all the time, always working on something, but she leads the development and implementation of public health programs to reduce health disparities, improve the quality of care, and increase the diversity of health-related workforce, as well as policy demonstrations and initiatives that target hard-to-reach, high-risk, and disenfranchised racial and ethnic minority populations across the country. She's had a public health career that spanned more than 30 years, and she's held several progressively responsible public health leadership positions at both local and state level before coming here in Illinois, Ohio, Wisconsin, and she also worked at the federal level at the Centers for Disease Control and Prevention. So I've got a whole other page worth of accomplishments, awards, and things that she's done over these 30 years. We don't have 30 years to read through all this, Sonsiere, so we're going to just wrap up the introduction there and welcome. And I have to say, too, you know, Sonsiere, you've put in a lot of time, a lot of hours working on the action plan and working on a number of things at this office, and I thank you, we thank you for being a good partner.
Well, thank you so much, Richard. We really appreciate it. I'd like to bring you greetings this afternoon from our director, the Deputy Assistant Secretary for Minority Health, Dr. Matthew Lynn. Unfortunately, he was unable to participate this afternoon, but this is a very important issue, a very important commitment that he's made in addressing viral hepatitis, and specifically in being able to move forward with the elimination of the disparities of hepatitis B and hepatitis C. I'd like to thank all of the speakers who have provided outstanding remarks this afternoon for our webinar. Their comments for me have been very enlightening, and I expect that they will trigger a host of questions during our Q&A session after I speak this afternoon. During the first webinar, we spoke about the 11 priority populations that are actually identified in the National Viral Hepatitis Action Plan. As well as for our webinar today, the focus has been on populations, that is racial and ethnic minority populations that are overrepresented in the stats for those impacted by viral hepatitis, as well as the impact for pregnant women and for the unborn child. I'd like to just note here the importance of closing the gap for viral hepatitis disparities for minority populations. What we currently know is that viral hepatitis disproportionately impacts minority populations. In the U.S., between 2044 and 2060, we know the Asian population will increase by 128%. The Hispanic population will increase by 115%, and Native Hawaiian and other Pacific Islanders, the population will increase by 63%. For individuals that identify as being either biracial or multiracial, their representation will increase from the numbers from 2014 from 2 to 5% to 6.2%. What's required, that is, in addressing the disparities that exist among various minority populations? First, that is, addressing stigma. What is it that we know? For example, first of all, how does a provider actually, when they encounter a person who is an immigrant, who also perhaps may have a substance use disorder and is infected with hepatitis C, how the provider actually encounters the language that they use when actually screening that individual, as well as educating that individual, would really impact whether or not that person chooses to move forward in that screening process and testing, as well as in receiving treatment. Next, how the provider actually approaches the topic of screening. Next. the next one. Yes, how they approach the topic of screening without further stigmatizing that individual. And most important, we must consider whether or not that language, the language that is used and the information about screening is actually delivered in a culturally and linguistically appropriate manner. One of the other questions that we often ask for those of us who are working in this field, that is what we consider our sphere of influence. Mm-hmm. How we actually educate those, our family, our friends, if we're members of civic, social, cultural organizations, how we go about actually sharing that information in a non-judgmental manner, mm-hmm. Being a person that's askable and approachable, really can have a huge impact for those in our community. And these are questions that we should consider in future discussions. It's very important that we take into account that with addressing this whole issue of eliminating and moving forward to addressing the disparities here for the populations that are identified in the action plan, we know that we must approach this in a collaborative manner, that it must be a very targeted approach, and it should be delivered in a culturally and linguistically appropriate manner. First, let's consider that we must be deliberate in our messaging. That is, we must ensure that people that may be perceived as being infected because of engaging in risky behaviors have access to prevention, have access to treatment, and have access to new advances of care without judgment. Mm-hmm. Secondly, we must ensure that our message is focused, and we must also educate and eliminate any misunderstanding, stigma, and shame. That is to increase access, again, to treatment and care in a culturally competent, a safe, and a comfortable environment. And finally, we must be steadfast in our commitment and also in moving forward to our involvement in communities across the nation in addressing the hepatitis B and C epidemic. Next one. So next, I'd like to thank Rich Walensky and Karina Dan for this opportunity and being able to speak today and providing this message. You'll notice on this slide is the contact information for the Office of Minority Health. Please visit our website or call or also access our social media to learn more information about the Office of Minority Health and the work that we're doing in addressing viral hepatitis as well as in addressing disparities. Yeah. Thank you.
We know the Office of Minority Health does a lot related to hepatitis, HIV, Absolutely. And a number of really critically important issues related to infectious diseases. So yes. We're in a lot of meetings together, and we've worked together really more Karina than I in those, but it's been really a good partnership during the time that I've been here. So we're going to take one last check and see. Last call, Thomas Green. Any sign of him, Victor? Nope. Okay. Well, that's going to help us because it's going to mean that we're going to have time for more questions today, which is really good. I just want to comment on Sonsiere's remarks, though, because I thought you did a really good job pulling together some of the themes I heard in a number of the presentations around stigma and how people stigmatize themselves and that they experience discrimination, negative attitudes from other people that are stigmatizing, and it kind of feeds that cycle. Yes. And you hit upon providers. And so, so I'm HIV positive, and from that experience, not the same as having hepatitis, but, I know how important my doctor really is to me and my health care and how important that relationship is. And if it's not right, how big a deal that is. And we hear in the meetings we go to, the work we do, stories of people who've had some really bad experiences. And once that's happened, it's hard for them to kind of reset and continue back in their care or to, really do the things they need to because of the system or one person in a system that is really big, and probably the system itself is really good, but it just takes one bad egg. And those are some of the things that we have to stay vigilant on and that we have to speak out about as well in this work. And really kind of have that pride, that respect for ourselves that says, I deserve good treatment, I deserve good care, and if I'm not getting it, I'm not going to put up with it. I'm going to do something about it. So really, appreciate you bringing that up and other people as well. So how are we going to do this?
Well, we have a couple questions that have come in during the talk, and we have some support folks on the other side of the table. Can't see them from where you're sitting, but I think it would be helpful if you want to kind of give us a question.
Sure. The first question, well, there are a few comments and then a question.
And let's kind of amplify that point a little bit, because part of the way GoToMeeting's made is called questions on the bar, not just the questions. We really do want to hear suggestions, input. I think in particular, good models and successful approaches that people have used that are really innovative, because we don't just sit around this conference room table thinking of what should we do for the nation to prevent these infections. We learn from the work that's going down in the community. And hearing about those are critically important to us. So, Selena?
So the first one, in New York City, reported cases of chronic hepatitis B continue to increase and have been increasing since 2013. How is HHS planning to support New York City in understanding why this is happening and curbing further hepatitis B infection, especially when this is a vaccine-preventable disease?
You picked one of the kind of most complicated, difficult ones to start us off with, Selena. Thanks for that. But these are kind of hard questions that need to be talked about. I think I'll start it off, and then we'll let kind of Karina jump in. Sonsiere, you're welcome to jump in too, if you want to. But I think one of the things that's really, important to recognize is kind of what is the role of the federal government in working with states in protecting the health and improving the health of the residents there. So it's really the states that have primary responsibility, and the federal government can't just kind of swoop in and decide, okay, we're going to do this. It really has to be a partnership. So those partnerships have to be in place, and they're good partnerships with New York, but there also has to be capacity and resources on both sides. And this is one of those issues where we're seeing hepatitis C go up, B is not going down, and then we go these outbreaks of A, and it's really hard for people to keep up with all of the needs that exist there. And quite frankly, we can't keep up with all the needs. So I would, Karina, do you want to say anything more specific about potential options? I would say, really though, reaching out to CDC, Division of Hepatitis, is really probably the best resource. I'm sure that they already have, but what words of wisdom do you have, Karina?
Well, I think that one of the things that New York has in place is a very strong surveillance system that can pick up things like an increase in new hepatitis B infections, and that just knowing that information gives us something to kind of react to. So I hadn't actually been aware that New York was one of the areas that had an increase in infections, and I know that they have a lot of buy-in and engagement. They have a number of task forces with really good engagement, both from the public health department, but also from the hospital system. So imagine that there's opportunity there to bring folks together to talk about it in New York.
And a couple of networking, using local resources, important. I think also, looking at resources that exist in different states and different cities. And so one great resource for folks who don't know is the National Alliance of State Territorial Health. Hey, directors, I'm just really messed up today. I'm not getting my acronyms right. But NASDAQ
You got that one right.
has, it's a little clippy though. So NASDAQ has, really developed tools, materials that are useful to states, and they can provide peer-to-peer assistance in helping people to learn from other people who've gone through these same problems and challenges and have gotten through it successfully. Also, I'd encourage people to go to the CDC website, cdc.gov/hepatitis, and they really have a great set of tools and resources that people can use both for responding to hepatitis issues in different settings, materials for campaigns, etc., and also some tools that people can use to do assessments and better understand what's going on in their area. And even more stuff that's not online, if you call them.
Did you want to?
Yeah. Sonsiere really shouldn't be on the hot seat here. This is really not. She just got the last chair and the last presentation. So.
So, another question?
Sure. So one user commented and questioned, Hep C and Hep B are both viruses of the liver. Other than that, they could not be more different. One needs to be addressed with newborns, pregnant women, immunizations, Asian communities, and the no vaccine community, and one is really growing among opioid users. Has there ever been any talk to separate the two completely? And this user went on to say, has there ever been any talk of changing the names of the hepatitises? I personally know of lives that have been lost because of the confusion. Most providers I talk to, unless they're in gastroenterology, don't distinguish between the hepatitis properly. I cannot tell you how many nurses have told me that they were routinely inoculated for hepatitis C because they work at a hospital. Has anyone talked about calling Hep C something completely different?
So the answer to that, I believe, currently is no. There is not a consideration underway to change the name. But I completely agree that we have a situation in which the names are very similar, and it is a challenge for those of us working in the field of hepatitis to try and distinguish and educate healthcare providers as well as especially, I think, the public, because hepatitis is more general a term, and just putting a letter after it does kind of facilitate confusion. So I'm sorry that that doesn't seem to be underway, but I think our work to continue to educate healthcare providers about the differences and make sure that people do have the correct messages, I think that really that question and the comment reinforce the work that we need to do here at HHS and with our state, health department and other partners to get the word out and get that clarified more.
Yeah. And I think that there's another example of kind of how advocacy can play a role in this. And I think by raising the issue, raising the concern, and speaking out about it, and I was going to try and Google real quickly to see who names infections and diseases, because it's not us. It's not me. Me and Karina aren't sitting here going, yeah, let's call this one K or E. They're bodies that are, have the role and responsibility for doing that, and the kind of procedures, rules, and stuff that guide that process. And so I think that this is a place where, advocacy has a real potential to, raise awareness and to encourage people to look at it more deeply and seriously, and to not only ask the question, but to put some proposals on the table as well.
Are you anticipating cluster outbreaks of hepatitis in recent storm areas, Texas, Florida, and Puerto Rico, as a result of flooding and close quarter living in shelters? If so, are there emergency plans for prevention and treatment?
So I think it's hard to anticipate what will happen. However, hepatitis A, which is spread fecal-orally, so from contaminated water or food, those kinds of outbreaks do happen in situations where people are living in shelters or don't have access to, water that's assured, kind of purified or.
But people know that this is a risk, and that's one of the things that they plan for as part of the response, and bring the water purification tablets, equipment, whatever, to really help minimize the risk of that and to be able to detect it. And I know that they, right after the hurricanes, are testing the waters of the bay and seeing, whether the amount of storm drain runoff had really kind of led to high levels of fecal material in the water that would pose a risk to people. So certainly this is something that people are aware is a risk, and is one of the things that they monitor and prepare for.
We also have colleagues at CDC that are ready to kind of respond when an outbreak happens, and are able to provide some amount of technical assistance. And I understand that on some of the hepatitis A outbreaks that are happening, that they've been called in. So I believe that in cases where there was an outbreak, that we'd also be able to call in our CDC colleagues to assist.
Yeah, and kind of just amplifying the point that I made earlier about the federal role versus the state role. So there's an outbreak of a new infection, hepatitis A, B, C, HIV, whatever. The state has to ask the CDC to come and provide assistance. So it's really at the state's discretion, and it is a local decision-making process as to whether that assistance is going to be helpful or not, and whether it's needed or not. And so CDC comes in when they've been asked to come in from the state, and there's kind of a formal process where people submit requests, and then they're evaluated and then responded to.
Great. So I think that we're really running kind of out of time here today. Do you want to take one more question, or?
Oh, that clock's not right. That's the problem. I keep on looking at that clock.
It's 4:39.
Okay. So you tell me. Do you want to take one more question?
Do we have another good question?
Is there any effort?
There's a lot of questions. Yeah, good. All the questions are good.
Anybody like Karina's eyelashes? We had, like, a week or so ago, we had another webinar, and we were commenting on my co-presenter's eyelashes, which I thought was hilarious. So.
Is there any effort by HHS to bring attention to the HCV in the mainstream media?
Yes.
Mm-hmm.
Do you want to talk about how we're doing it?
So it is, I mean, it's something that, because this is so closely tied to the opioid epidemic and the impact that it's having, it is, something that, people here are talking about the response to the opioid epidemic each and every day, multiple times a day, and we're in there, here, raising questions, concerns, providing information about the impact of viral hepatitis. And so we're organizing events, seminars, bringing in people to talk about the issue and to really do whatever we can within HHS to raise awareness and also to kind of bring information out into the world that is helpful to our partners and other people around the country. And so our blogs are really a small thing that we do, so I'm not going to kind of make it sound like blogs are going to change the world, but it really is something where we're thoughtful about the issues that we're focusing on, and we're really kind of trying to use those to, draw attention to the things that, we think are really kind of, they're important in one way or another, that we start thinking about them, they're new, or they represent kind of a shift, or they're highlighting what is, quite frankly, a problem that we've known about for a really long time, but we need to be staying focused on it because it's still a problem and we need to do better. So the media activities are things where, we're not directly involved in the media planning and communications, but it is something that this is an issue that we're talking about and trying to move the needle on. And it's also one of those issues where our partners do a really great job in bringing attention to these issues. So, and sadly, when we have outbreaks, like we're seeing with hepatitis A right now, those also draw attention to the issue and provide opportunities for people to remind everyone that these risks exist and these problems are serious, and that we shouldn't just be waiting for the next outbreak to happen. We should be preparing in advance, and with A and B, getting people vaccinated so we don't have these again. And so it's really good to see as part of these responses that there have been large efforts to really vaccinate a lot more people in these communities. And it's sad that we have to do it in response to an outbreak, but it is happening, and those people will be protected in the future, and it'll make other outbreaks that much less likely to occur because there aren't people who are going to be susceptible in the same way. So I think that's about all I had to say on that one. Do you want to kind of just take a second and do any kind of closing remarks from folks? Karina's ready to be done. She won't say anything closing, I think. So.
Here's the thing that, I mean, what you were just talking about, we have these tools.
Yep.
With hepatitis A and B vaccine, with hepatitis B treatment, with hep C treatment. We have the tools. We have models. We can look to other diseases that have had an effective response, that have been able to really bring communities together to work together better and stronger. And so I think with that, we have an opportunity with hepatitis to strengthen our collective response, to use those tools that we have in hand better. And I think that now is the time where we've got to seize those opportunities. We've got to identify them, and we've got to work to make the most out of the opportunities that we have to really address and begin that vision of getting to elimination of hepatitis.
All right.
Starts here.
Carpe diem. All right, very nice. Sonsiere, you want to?
Yes. So I'd like to thank you again for participating this afternoon. And for those who are out there who are listening, I'd like to really challenge you. First, consider your sphere of influence. That is, as a professional, for those that you work with, for providers, if you are part of a social support organization, consider the fact that we need to actually identify messages that are, one, non-judgmental. Secondly, that inform the persons that we're intending to reach. And then third, that we want to be available or identify resources so that individuals who are interested in seeking additional information, who would like to know more about screening, vaccinations, as well as treatment, that they can access that information. Secondly, consider your role individual as a member of your family, as a member of your cultural group, your community. What information can you share? How can you share that? And how can you approach others so that you can have an open and honest discussion, a dialogue, and also connect individuals to additional information via their websites from our colleagues here in the Office of HIV, AIDS, and Infectious Disease, as well as your local health provider and health department. So I'd like to thank you again, and we look forward to continuing our work together in this very important issue.
Yeah, ditto. So, so we're going to wrap this up. We've gone 15 minutes over. Thank you for hanging in there with us and letting us go on a little longer. We wanted to get to as many questions as we can, but I think we just kind of scratched the surface, didn't we? We've got a bunch of questions and comments left to get back to folks on. So we have your email addresses. We'll be able to do that to you. You'll also be getting some additional information from us so we can do an evaluation of the webinar, give us your input. And if you have any other recommendations, suggestions, please do send them our way, because we don't have all the answers. And like we said earlier, we depend on you to show us what's working in your communities and to learn from that and to help raise those successful programs up so they can be models for the rest of the country. So thank you for being here today, and thank you for doing what you do each and every day. Bye, everybody.
Bye-bye.
Bye.